This training is designed to assist public health employees understand the LCTS codes for completing random moments. There are two objectives for this training. First, we want you to leave with a better understanding of the LCTS activity codes that apply to public health employees, what they mean, and how to choose the correct one. Second, we'll show you where to find reliable resources and reference materials so you can look up additional details or guidance whenever you need it. As mentioned in the previous training, you'll receive a random moment that looks similar to this example. On the left-hand side of the screen, you'll see a list of lettered options. Those are the activity codes you'll be selecting from. This training is designed to help you understand what each of those codes actually means and where to find additional resources that are specific to your role. Before we go into each of the codes, it's important to remember that codes A through F are specifically tied to children who are either in foster care or at imminent risk of foster care placement. This includes activities like assessing risk, providing case management, completing administrative work related to those children, or even attending training focused on working with at-risk youth. If your activity doesn't relate to one of these situations, then you'll want to select a different code outside of this range. Codes A through C all connect to children who are either in foster care or at risk of entering it. Code A covers activities related to assessing or reporting possible child maltreatment. Use this code when you are actively involved in determining whether a situation meets the criteria for mandated reporting or requires a foster care candidacy referral. Examples include consulting with colleagues about a disclosure, discussing whether the situation meets the threshold for reporting, or completing documentation related to that decision. It's important to note that this is a short-term activity. It only applies up to the point that a report is made or the decision is finalized not to make a report. After that, ongoing case management or service coordination would fall under a different code, depending on the type of activity. Code B covers coordination work, such as when you're helping align services or support for a foster care candidate. Code B3 applies when you're coordinating services for a child already in foster care. It covers activities like collaborating with social workers, agencies, or service providers to support the child's case plan, evaluate services, or assist reintegration back into home or school. Remember, this is coordination only, not direct service delivery. It also includes time spent on communication, documentation, and travel connected to these coordination activities. Code B2 focuses on preventing foster care placement by coordinating services that keep children safely at home. It includes activities like working with county staff, school personnel, and community providers to identify needs and connect families with support. These can involve meetings, phone calls, or case planning related to stabilizing the home environment. Again, the key distinction is that you are coordinating services, not delivering them. If the child later enters foster care, coding should switch back from B2 to B1. Code C covers both general child welfare administration and court-related work. Use the first part when participating in discussions or planning about child welfare systems in general, not tied to any individual case. The second part applies only when the work is specific to a child in foster care, such as helping prepare for or attending court hearings or reviews. Always code the activity based on who the work is for, general system level child welfare versus specific child's case. B3 is a new code. It focuses on service coordination for children identified as prevention candidates, meaning those who are at risk of entering the child welfare system but are still in their home environment. Staff should use this code when their work involves coordinating, monitoring, or facilitating services intended to prevent child welfare involvement. Examples include referring families to motivational interviewing or parents as teachers programs, communicating with social services about service effectiveness, or participating in meetings to plan or review prevention supports. Even administrative tasks like documentation and travel count under this code when they directly relate to those prevention service activities. Essentially, B3 captures efforts that support family stability and child well-being through proactive, Coordination before formal child protection intervention is necessary. Code D is used for training related to child welfare topics. This includes professional development, presentations, or workshops focused on early identification of children in need, foster care candidacy, or family preservation efforts. The key point is this is training time, not direct service time. Whether you're attending, leading, or coordinating these sessions, it all falls under Code D. And don't forget to include paperwork and travel time related to the training. Code E applies when you're training foster or adoptive parents. The focus is education and skill building for those caring for children in placement. Code F is used when you're actually providing treatment or therapeutic counseling, whether it's one-on-one, family sessions, or group therapy. Both codes emphasize direct support to improve child well-being and family stability. And always include time spent preparing materials, completing documentation, or traveling for these activities. Codes G through I all relate to medical assistance in some way. Code G is focused on helping families learn about MA or determine eligibility. Code H is about coordinating or referring for MA-covered health services. For example, connecting a student to day treatment. Code I is used when you're directly providing a service that could be billed to MA, even if you don't personally handle the billing. Think of it as a direct care category within LCTS. Codes J, K, and L cover general non-program or intake-related work. Code J is for tasks unique to your role that don't fit other codes or are billed elsewhere. Code K includes admin time, personal time, or when you're away from work. Code L applies when you're gathering information to determine whether an LTSS assessment is needed. Codes M through O focus on intake and assessment processes. Code M applies to general intake, screening, or investigative work. Code N is for LTSS assessments or support planning for individuals who are MA eligible or whose eligibility is still unknown. Code O applies to those not MA eligible or who have a county health plan arrangement. Code P is also a new code. It is used when you're participating in training or education related to child welfare prevention. This could mean attending a session on identifying students at risk, understanding prevention candidacy, or working with partners to strengthen early intervention and family support. The focus here is building staff capacity, helping staff recognize when a student or family may need services to prevent child welfare involvement. You can also use this code if you are the trainer, leading the session, or if you're completing related paperwork or travel. In short, Code P supports all efforts to ensure our staff are trained and prepared to identify, refer, and support students before issues escalate into formal child protection situations. The purpose of today's training isn't to memorize every single code or situation. That would be overwhelming and unnecessary. Instead, this training is designed to help you understand the overall structure of the codes and how they relate to your work. You'll also get information about where you can find additional support and reference materials if you ever need help choosing the right code. All of these materials are available right on the website where you access this training. The code chart gives you a quick snapshot of all the codes A through O. I recommend printing or bookmarking it. Note B, 3, and P are not on the chart since they are new, but they are found in the reference guide. The reference guide goes a little deeper with examples to help you decide which code best fits your activity. Just a quick reminder about participant responsibilities. When you get a random moment email, try to respond within 3 business days. It really only takes about a minute to complete. These random moments are what help capture and understand the kind of work being done across different programs. Make sure to allow the DHS email address so those messages don't end up in your spam folder. And if you ever have any questions, your site contact or LCTS coordinator can help. At this point, you should have completed both parts of the LCTS training, the overview of the program with the random moments, and now the code selection training. Your next step is to go back to the website where you accessed this training and complete the participant checklist and the Google form. These forms confirm your eligibility and are required before you can begin receiving random moments. Once those are submitted, you'll be all set to participate. Your LCTS coordinator is listed here if you have any questions.